Hi, it's Dr. Artie Kavanaugh coming to you for Room Now from ACR Convergence 2023. Big meeting, lots of posters, lots of interesting information. There's one abstract, as happens sometimes, that really gets your interest, and there's some things that you still want to see more fleshed out about. This is 294, and the abstract is about the impact of Tofacitinib treatment on skeletal muscle in rheumatoid arthritis. So one of the things that we've noticed with our JAK inhibitors is that when we treat patients and we monitor laboratory values, we see an increase in CPK. And that doesn't necessarily seem to be pathologic, and we don't see weakness, we don't see frank myositis. So what do we do with that? Well, this is an interesting study, small number. It was called the RAMRA study, open label, single center, 15 patients who had at least one other risk factor for muscle weakness, sarcopenia, which is a big problem. Inanition, wasting, bad things which lead to frailty in patients with RA. What they did was measure muscles, and they did that by looking at MRI before and after treatment. And what they found out is that it did seem that the JAK inhibitor therapy, in this case it was with Tofacitinib, may have had an anabolic effect on muscle, which might explain the high CPK, insofar as that some muscles seem to be larger as a course of treatment. And there's a molecular rationale that could explain that. So I think with the specific therapies that we have, they do target things that we understand, but how the body interacts in these complex cascades, we don't know. So I think that these data are intriguing, and I'd certainly love to see a follow-up with further analysis into it. So for Room Now, this is Dr. Artie Kavanaugh coming to you from ACR Convergence 2023 in San Diego.